wanted to hide something from his wife, why wouldn't he hide it in the office?
And maybe she's hiding something.
A teal and a junk.
Taste?
Yes!
Metallic taste?
Yes!
Oh, we have a new symptom, tasting metal. What does that mean? Very excited to be reacting to House MD Season 2, Episode 10, Failure to Communicate. On this channel, we are reacting to all 177 House episodes. This will be episode 57. Let's see if I can get the diagnosis before House does, as a doctor working in London.
I've given up drinking. I've given up drugs. Greta taught me there's two things you never give up. One's rock and roll, the other's a source. I only hope you can adjust to the lack of stress in your... Why disqualify the rush? I'm tabled.
Well, it seems like it's a dual leaving party now. There's no doubt about what the patient has here. It's called receptive aphasia. It's due to damage to the main language comprehension area in the brain, called Wernicke's area. The fact that he could stand up and still move, seeming otherwise asymptomatic, it means the damage is likely localized to that area. Also, this would be a very extreme case, as usually the words said would be at least partially related to the original ones, like watch instead of clock or dock instead of clock. What this patient has in that case would be what we would call word salad. Reading would also be impaired, and so would repeating what someone else says. The most common cause of that would be stroke, but that wouldn't present with collapse like it did here. So what else could cause it? Trauma, tumors, central nervous system infections like meningitis or encephalitis, or degenerative brain disorders. Let's get more clues.
I want you to write your name and draw a face.
It's called agraphia. Loss of ability to write.
This actor has some serious facial expression skills, but the writer hasn't backed him up. It's a subtle detail, but when Foreman asked the patient to write his name and draw a face, he looked at him as if to say, "Really? That's so easy." Yet the patient has no idea at this point what they're saying. But with receptive aphasia, you not only lose the ability to speak, read or write, but also to understand language. So there's no way he'd be able to know what Foreman's instructions were here, with his symptoms being as severe as they are. Still makes for great TV though. So how was this language supercenter of the brain even discovered? Carl Wernicke was a 26-year-old physician in training and noticed that many of his patients were having difficulty with word finding, and some were saying completely incomprehensible words. Eventually, one of those patients died, so he examined their brain, as you do, and found that there was a tumor close to the auditory cortex that processes sounds. He concluded that this area has to be a second language processing center, and he was right. So they named it after him. He's doing pretty well, because the only thing I've had named after me at 31 is a parking ticket and a cup of Starbucks.
Every case you have rates a 5 on the complexity scale.
Dr. House has a rather specialized practice.
Patient, 62 years old. You prescribed Viagra. I look in vain for the words erectile dysfunction in the notes for Dolores Smith.
She had a heart condition.
Although Viagra can be used as a heart medicine, I would bet my left kidney that Viagra never got to Dolores Smith. I hope House has a comfortable motorcycle seat. If you're wondering why House is being grilled by the suit, it's because he's away with Stacy trying to defend all his Medicaid expenses. That means Foreman's stuck running Princeton Plainsboro all on his own. Not sure how he's gonna handle this case because the last one didn't go too well for him. Back to Viagra because it has a spicy history. In the late 80s, two scientists called Peter Dunn and Albert Wood created sildenafil citrate, believing it was going to be used to treat angina and high blood pressure. Then in the early 90s, Pfizer started running clinical trials and almost scrapped the drug because of the lack of heart benefits. But trial volunteers noticed a curious side effect of increased erection even days after taking the drug, so they went back to the drawing board and the drug side effect became the effect. It was released in 1998 with licenses in the US, Brazil, Morocco and Mexico. It was so popular that the CIA even used it to make friends in Afghanistan, as the little blue pill had more value than cash. I hope the goodie bag they gave also had lube. The desert isn't famous for its moisture.
So two saps going down.
Fluid on his lungs.
Push 40 IV LASIK.
We need to intubate. He's losing his respiratory drive. Down, get him down.
40 IV LASIKs. 40! That's like trying to clear water out with a sippy cup. You see, this patient had so much fluid on his chest that it caused a respiratory arrest. That means the fluid needs to be offloaded as soon as possible. So you need probably around 80 milligrams of Lasix, also known as furosemide, in a respiratory arrest situation like this. So why is he building up fluid though? The easy answer is heart failure, but a better answer, and my first diagnostic guess, is that he has a brain tumor leading to a paraneoplastic syndrome called SIADH. That stands for Syndrome of Inappropriate ADH Secretion. ADH causes your body to retain water. If you've ever wondered why alcohol makes you pee so much, it's because it blocks the release of ADH. So this would fit so well, and the way to test for it would be checking how dilute both the blood and the urine are and seeing if there's a difference to what you would expect. Also may help to scan the guy's head at some point, considering he could have had a stroke, then take it from there. Great episode so far.
Urine test is positive for amphetamines.
It's not the drugs.
CT scan was negative.
Get an MRI and get a better medical history.
But the drugs.
They're medicinal. He was having trouble sleeping.
This may sound a bit odd. Stimulants to help you sleep. You wouldn't exactly do a line of coke, then hit the flotation tank. Well, around 96% of people who take stimulants will have reduced sleep. There is a subset of the population though where they can actually cause sleepiness. Those are patients with ADHD who have disturbed sleep from their condition that is helped by stimulants like Adderall. We know that people with ADHD can be quite creative, and this patient is a professional writer, so maybe he does have ADHD. Seems like he had quite a crazy lifestyle before he got married and now has given up all the drugs except for amphetamines. Question for you smart people, what percentage of the population have ADHD? Answers down below.
He needed something to perk him back up during the day.
There's a little edema, brain swelling, and an area of scarring.
So what are your orders?
I break into his place.
Totomax.
Ah, the amphetamines were the uppers after the downers at night. The simplest explanation is always the best. One thing that is curious here is that for SIADH to manifest itself, the tumor doesn't need to be in the brain. The MRI seems like it's excluded that. If the tumor was elsewhere though, it could cause the same effect, and there is even a condition called hyponatremic encephalopathy, which is known as a great stroke mimic. That could be caused by a lung, bowel, or a urinary cancer. I definitely want a chest x-ray, urine dip, and stool test for blood before breaking into his house. I wonder about the name as well, failure to communicate. It probably has a double meaning, like the patient can't speak and also has not been telling us something. Sounds like he's got a tough relationship with his wife as well. So maybe there's a little bit of masqueraded hanky-panky going on. Let's find out.
He wanted to hide something from his wife. Why wouldn't he hide it in the office?
And maybe she's hiding something.
A till and a junk.
Taste?
Yes!
Metallic taste?
Yes!
Oh, we have a new symptom, tasting metal. What does that mean? You see, the most common reason is gum disease, followed by taking medicines like metronidazole or chemotherapy, none of which seem to apply here. It could also be undiagnosed cancers or kidney or liver failure. Definitely need more clues, but well done to Cameron for figuring out what the patient was trying to say there. Patients with medical conditions that inhibit communication can get so frustrated, and you can see why. When I was working in the hospice, I once had a 52-year-old patient with motor neuron disease, and his way of communicating was to draw the letter he wanted to say on his hand with his finger. His hand had a slight tremor though, and not being used to that communication method, none of us could see what he was trying to say. The reason why he was with us was his wife, who was his usual carer, wanted a holiday, and so there was nobody who could look after him while she was gone. Poor guy tried so long to spell out the words he wanted to mention, but none of us could understand. We now have so many communication methods like iPads or alphabet and picture boards, but we couldn't retrain him. Thankfully, his wife was only gone a week. I bet he was never happier to get home. Now, if you want to make this channel your home, then check out the channel membership. You get priority access to new videos, access to exclusive polls, and to suggest another series and episode for me to react to. The first 30 members have a chance to win a 1-hour one-on-one tutor session with me on a topic of your choice. We currently have 25 members with only 5 spots left, so press join below to secure your spot before they're gone.
We had a fight.
So you had a fight. sure it'll blow over.
It was about nothing.
Of course it was. Mark's tired, he's worried, he's got mobility problems.
He's pushing me out of his life.
Yeah, it's all your fault. You know, Stacy in the original Greek means relationship killer.
Stacy's being quite intuitive here, reading behind the lines. Apparently her and her husband were arguing over mail pickup times, as in postal mail, not the other mail. The truth is that arguments like this are never about the little thing itself, it's about an unresolved issue or the way that we're communicating. Sometimes there can be a mismatch between emotion-focused coping and problem-focused coping as well.
You do have a nail in your head.
It is not about the nail.
Are you sure? Because, I mean, I'll bet if we got that out of there...
Stop trying to fix it.
Another way to look at this is if your partner shares a thought, whether you react or respond. Reacting is a secondary emotion which is about defending or protecting, like anger or blame. Responding would be by sharing a vulnerable primary emotion like fear, sadness or shame, and those are disarming and inviting. Let's take the example of doing the dishes. What does doing the dishes mean to your partner? What is the narrative they tell themselves when they don't get done? Does how you respond validate this catastrophic conclusion or debunk it? Arguing over simple things is never as simple as the thing.
Oh, your aphasia guy's tasting metal.
He's got kidney failure.
If your husband continues to decline,
You'll die.
I know what you just heard is scary as hell, but
Couldn't tackle the bear.
Couldn't tackle the bear? Should have asked Habib for tips. Seems like all it took was an obscenely long needle and the fear of death to tickle the truth senses. Earlier in this episode, the team were asking if there's anything at all he was holding back, and he said no. The truth is, a patient with this condition wouldn't have been able to understand that question, but we'll park that in the name of making good TV. So what could he be hiding? Well, where there are amphetamines, there are parties. Where there are parties, there's fun. Where there's fun, there's sexually transmitted infections. Maybe our writer has syphilis or HIV. We know how he had some brain swelling as well and a condition that mimics a stroke. If his immune system is shot, then he could have toxoplasmosis secondary to HIV, which would be my second guess. Writers are always looking for stories. Now he's definitely got one.
Due to weather conditions, all flights are grounded until further notice.
I booked a room at the airport hotel when I saw how bad the weather was. It's the last one available. Hotel's upstairs.
House is looking at her like, is this a trap? I go up with puppy dog dreams of steaming love and romance and leave with one kidney and an eye patch. Now, if you were Mark in this situation, stuck back at home, knowing that your wife is on a trip with her ex, who's done nothing but try and sabotage your relationship, how would you cope? What would be going through your mind? Have you ever been in a similar situation to this? Answers down below.
I have to know what's going on here.
Relationship's like an addiction. No, it's like Vindaloo curry. No matter how much you love curry, you have too much of it, it takes the roof of your mouth off.
This is definitely getting spicy. I have to admit, when she said he's like Vindaloo curry, I understood the reference straight away, but burning the roof of your mouth wasn't the side effect I was thinking of. It was more like when you buy a Vindaloo, you pay for a curry and a new underwear drawer. Now they're in this hotel room together. Cheating seems quite inevitable. You know, 1 in 3 men and 1 in 4 women actually have an affair while married. So why is it higher in men than women? Some theories say an evolutionary basis, men take as many opportunities to pass on their genetics as possible, and women prioritize commitment to help protect the child, create stability, and meet social expectations. There are certain points when cheating is more common, like sadly 1 in 10 fathers-to-be cheat on their partner during pregnancy. It's also more likely to happen in relationships where they have a lack of communication or sexual incompatibility. There are interesting other gender differences as well. When thinking about the threat of cheating, women find emotional infidelity more threatening, whereas men find the threat of sexual infidelity more threatening. That's likely due to a man being worried about raising a child that isn't theirs. It isn't just humans that cheat though. Birds are seen as socially monogamous, but still stray from the nest every now and then. It's actually so common that it's got its own scientific name: extra pair copulation. What more can you expect though from an animal with a cloaca A combination of intestinal, genital, and urinary tract all in one. One ring to rule them all.
God, I really miss curry.
How did the LP go?
Preliminary results of some kind of infection.
He was trying to tell us something. He couldn't tackle the bear.
I'm gonna take this phone downstairs so I don't disturb you. Is that okay?
I've said earlier that things don't always happen for a reason, but the timing on that phone call can't have been accidental. Poor Stacy was expecting a vindaloo and got delivered a chicken korma from a jar. Back to the patient. When I said that patients with receptive aphasia say similar words to what they mean, so they're trying to crack couldn't tackle the bear to see what related sentence the patient was actually trying to say. House is really testing my doctoring skills here with this one. Maybe couldn't tackle the bear really means I had a coke-fueled orgy with 16 Swedish supermodels. That must be it.
Is it bear as in naked?
Theory is he can only talk with a needle in his back or...
When his wife's not in the room.
Patient, are you bipolar?
Yes.
Are you serious? The writing on that riddle is crazy. Let me explain. The patient kept saying tackle the bear. There's an old riddle that goes like, you build a house and each wall has a sudden exposure. A bear walked past, what color is it? The answer is white because the house is in the North Pole. North Pole, bipolar, house got all of that from tackle the bear. Definitely a slam dunk victory there. So how is the patient being bipolar relevant here? Well, if the patient is on topiramate, then it's not so much of a stretch that he's also on lithium. Lithium causes a condition called nephrogenic diabetes insipidus, as it blocks the action of a hormone I mentioned before called ADH. Rather than causing low sodium like with ADH, which was my first guess, it can cause high sodium that can mimic stroke and would definitely fit this case. So my third and final guess is lithium-induced nephrogenic diabetes insipidus. Say that 5 times in a row.
You have to come with me, sir.
I'm not going anywhere.
You're either on that plane or you're going into custody.
You couldn't tell anybody you were bipolar. Which was fine until you fell in love. Did you hear that there's a surgical cure? Bilateral singulotomy.
What? If House could get all of that from couldn't tackle a bear, then the only thing bigger than his brain is his self-restraint. Did you see how he left Stacy to go crack the case? Talk about playing hard to get. Now, can you cure bipolar disorder with surgery? Well, the procedure House was speaking about, a bilateral singulotomy, was introduced in the late 40s as an alternative to a lobotomy. Surprisingly, taking out part of someone's frontal lobe had some unpleasant side effects, like changing someone's personality. So clearly, the logical conclusion is they were just taking out the wrong part. Surprisingly though, it worked. So why did they end up going for the cingulate cortex? Well, it was believed to play a role in emotions and can go wrong in conditions like depression or OCD. The procedure is actually still used to treat refractory depression, chronic pain and OCD, but not bipolar disorder. Over 70% of people who have the procedure state there's an improvement with it, but there are complications like we've seen here: seizure, nausea, vomiting, brain swelling, and headaches. Exactly the symptoms our writer has.
It's not the surgery, it's the secrecy. What causes recurring fever? Neurological problems, lethargy that you fight with caffeine pills and amphetamines. With the secret trip for your secret surgery in Caracas or Buenos Aires.
Wait, does House mean malaria? That causes all that he mentioned and could have been transmitted with something as simple as a mosquito bite. Being a risk taker, I bet he didn't take any medication to protect himself. Malaria causes fever around 1 in every 2 days as well. You could diagnose it with thick and thin blood films, which would show the parasite with these classic ring-shaped lesions called trophozoites. This would be classified as severe, so could be given a drug called artesunate to clear it up if he's positive. I'd be so happy if I got this, but since I'm out of guesses, then looks like House wins on this one.
Get some blood on a slide.
Cerebral malaria.
She'll be back.
2 people who weren't meant to be together. Maybe they'll get a happy ending just because they both want it so much.
Cerebral malaria! I got it, but too little, too late. Now, something tells me House and Stacy aren't talking about the patient, and this isn't the end of that saga. Really good episode, 8 out of 10 entertainment, 6 out of 10 accuracy, mainly because the patient wouldn't be able to understand what they're saying, and 8 out of 10 diagnosis. This episode only makes full sense when you watch the previous one where a patient deceives the team here.